The construction works at Mulago National Referral Hospital commenced in November 2014. It was envisaged that the remodeling of the hospital into a specialized health facility would take 2 years to complete. But even now, more than 3 years later, construction works are still going on.
We did not give the entire building to the contractor at the same time. We remained working in some parts of the hospital while they were working on others. So that also, I think, affected the progress of work.
Kusasira further explains that some units were broken down and completely reconstructed to shoot the intended objective of building a specialized hospital.
There was addition of civil works. They ended up constructing afresh, demolishing a building and starting another one. For instance, we did not envisage that we would need a new structure for operating theaters. So we ended up building a new thing for operating theaters, 22 operating theaters, ICU, intensive care unit, 40-bed capacity in ICU. That also was built afresh. We have actually finished. The Department of Pathology, what we call mortuary, we built afresh. There was another ICU for children, pediatric intensive care unit on level 5. That was also built afresh.
The new facility is expected to provide health services that some Ugandans have been seeking overseas.
Talk of hip replacement, we have never done it at Mulago. Talk of kidney transplant, we have never done it here. That is the infrastructure we are putting here. That is the kind of training we have given our doctors to offer a super specialized service that we have not been offering before. Service for which Ugandans have been going to India and South Africa and other countries where there is specialized care.
Once it is completed, it will not be offering the same range of free services Ugandans have become accustomed to.
We cannot talk about a cost now. What we want to do is to put the infrastructure in place, to have human resource trained, to have equipment. The issues of cost are being handled by our policymakers. Ministry of Health, Cabinet, they are working on a document that will regulate how the institution will be run. Shall we be paying? If yes, how much? And who will be paying? But it is too early for us to diverge our thoughts. But at the right time, we shall share our thinking with the public.
The government of Uganda borrowed $49 million, approximately 176 billion Uganda shillings, from the African Development Bank for the hospital remodeling project. $29 million was meant for remodeling the hospital, while $20 million was for buying equipment.
We have already started installing equipment. Some equipment is already installed in parts that are complete. We already have MRI machine here. We have so many CT scan machines here. We have ultrasound scans, we have X-rays. We have already started installing all those ones.
It is not clear when the contractor will hand over the facility to government as Ugandans await to use the new services. Jingo Francis, NTV.